Welcome to our Primetime Alive program, Ames Surgery Center Update. I'm Vicki Newell with the Primetime Alive program here at Mary Greeley. As a reminder, if you'd like to join Primetime Alive, if you would like to sign up for a program or find out more information about our benefits, please go to our website, mgmc.org/PTA. Our presenter today is Amber Deerdorf. Amber is Vice President, Chief Nursing Officer, and Chief Operating Officer at Mary Greeley. And yes, she is one person, but she has 3 titles. She has a bachelor's degree in exercise science from Iowa State and a bachelor's degree in nursing from Grandview University. She went on to achieve a master's degree in public administration from Drake University. She has worked at Mary Greeley for 22 years in a variety of roles. She is currently the executive leader of the inpatient medical units, laboratory services, radiology services, cardiopulmonary services, rehab and wellness, surgical services, human resources, education management, and outpatient clinics. Please welcome Amber.
And probably a few other things, but hi. I'm so glad to be here today. Thank you. I know it's kind of rainy, not the best day, but I was telling Vicki earlier, I think this is my 3rd time I've been able to speak to Primetime Alive and all of you, and I love it each and every time. I'm so excited. So thanks for inviting me back. I do want this to be informational for all of you as well. So I do have a few slides here, and they are pretty high level. And so I think it'll take about 30 minutes for me to go through the content. And then I would love the rest of our time together to just be questions and answers. And so if you have any, certainly write them down, and there'll be plenty of time at the end to answer any burning questions you may have. I'm going to grab my slide. Okay. So as we're looking at our content today, I thought we should first look into what is an ambulatory surgery center. I'm assuming some of you know, maybe all of you know, but I'll just talk through that briefly. And then I'm going to dig deeper into the Ames Surgery Center. So I'll let you know the different specialties that will be out at the Ames Surgery Center, where it's located, some of the timelines associated with that. And then briefly we'll go over the ownership structure, who owns it, and then kind of that question of, well, why are we investing in a surgery center within our community? Why wouldn't we just keep all these services within the hospital? So if you had other questions outside of that, write them down. We'll have time at the end. So starting, what is an ambulatory surgery center? These are those outpatient facilities. Within the state of Iowa, we see a little bit less, but certainly if you go to different states, especially out on the coast, you may see surgery centers within some of the strip malls, certainly on almost every corner. I was in Denver recently, and truly downtown, I think you could throw a rock and hit a surgery center. So Iowa's a little bit less because we have some laws and regulations that prohibit the excessive growth of surgery centers within our state, but they can be multi-specialty, which is our center, or they can be very specific to a specialty. So if you think of some of the GI procedures that we do, colonoscopies, those make perfect sense to take place in an outpatient facility. So you'll see a lot of those endoscopy centers around. Surgery center, there's a lot of benefit to it. So you can see it benefits our community, each and every patient that we serve, and then it is a lower cost of care as well. So as we look at the Ames Surgery Center, this is a drawing and a rendering of what our architects drew way back when, and it is multi-specialty. So you can see the different services that will be available to all of us out at the surgery center. GI, general surgery, some of the gynecology procedures that we do, eyes, orthopedics, ears, nose, and throat, plastic surgery, podiatry, so foot and ankle, and then urology services will be available out at the surgery center. So location, if you've driven on Dayton recently, you probably have seen the building. I have a few pictures right after this slide that show some updates on what it looks like now. Just to orient you, so 13th Street, this is I-35 right here. Right now, we're sitting at Mary Greeley Medical Center, so on the corner of Duff and 13th Street. Our surgery center is going to be Dayton Avenue, just north of 13th Street. That animal disease lab, it's directly across the street from that. So it's a big brick building right now. You can't miss it. And this picture was taken just a couple weeks ago. So it is a building, concrete's in, walls are up. We're towards the end of the construction phase. It's almost on time, and I'll get to the timeline here in just a little bit. Workforce within the trade industry kind of hurt us by about 2 months. So we had trouble getting in enough people to help with the finishes. So we did delay the project opening by about 2 months because of that. But everything else, all the equipment, everything else came in pretty much on time. So we haven't experienced too many delays in that project. And then here's one picture of the inside. The energy drinks, the pop sitting there. But we do have walls up. You can kind of see the colors. This is a picture of what the nursing station would look like within the facility. All right, so going into the ownership structure just a little bit. Mary Greeley is very much a part of this, as is McFarland Clinic. So if you know a little bit about this industry, there's a lot of rules, regulations that surround it. So for a hospital, it's pretty easy to be a partner. It's 50% Mary Greeley. With the clinic, there are some Medicare rules that state that in order for a physician to be a partner in a surgery center, they need to do at least a third of their eligible outpatient cases out at that center. And so part of this is McFarland Clinic has a group of surgeons and anesthesiologists that have created a separate LLC, this McFarland Clinic Surgeons Investors Group, that have bought into the surgery center. So these groups of surgeons and anesthesiologists that will work out there, they also are partners and will receive some of the revenue that comes out from the surgery center. So why did McFarland Clinic and Mary Greeley want to partner together? Why did we want to open up a surgery center within our community? This list is a lot longer, but I'll stay with these three and then we can talk more about it as well. First and foremost, we have an excellent partnership with our surgeons here in our community. One of the questions you'll probably ask me eventually, is it just McFarland Clinic physicians and surgeons that will work out at the Ames Surgery Center? Right now, yes, but that's not the intention long term. So this is new for both Mary Greeley and McFarland. We want to make sure that we understand the ownership structure. We want to understand how this surgeon anesthesia buy-in works. And then absolutely, so like if you think of Wolf Eye Clinic, if you think of Iowa Heart Cardiology, some of those other services that are available within our community, some of those clinics that are available, they could in the future certainly work out at the Ames Surgery Center as well. But it's going to start with just Mary Greeley and McFarland physicians out there right now. Part of this was also our ability to recruit the surgeons into this market. So as an industry, what we're starting to see is these young surgeons coming out of school, as we spoke about earlier, there are surgery centers everywhere. And this is another opportunity for them to have some revenue coming in from the procedures that they're doing. And so when these surgeons come out of school, these orthopedics, they would expect to be able to be a partner in a surgery center within their community. Ames in our community didn't have that offering, so we were missing out on some really good recruits to come into our community since they didn't have this opportunity. So our recruitment of surgeons into Ames has been actually quite fantastic since we have been able to offer this as an opportunity. So we're already seeing the benefits of getting really qualified surgeons into our area. It is a lower cost of care for all of us, and then it's also a lower cost of care for insurers or the people that pay the bills. To do the exact same procedure. So we'll take a colonoscopy, for example. If you're on Medicare and you come into a hospital, that Medicare procedure costs, it's about $1,500. So that's what the insurance company is going to pay Mary Greeley Medical Center for that colonoscopy procedure. If you would have that exact same procedure at an outpatient facility, it's about 60% of that cost. So it's much lower cost for the insurer. And then that's also your out-of-pocket, what you're paying out-of-pocket as well. So if you come in for that same procedure, you might pay $500 for that procedure here at Mary Greeley. It would be about only 60% of that cost out at the surgery center. The next question may be, well, why is that so? Why can't Mary Greeley just charge less? And so if you think of what a hospital is and some of the overhead a hospital has, we have a 24/7 department within our emergency department. We have a CT scanner up and running at all times. We have to be ready for any emergencies, traumas. We have medical units here. So our overhead is significantly more. We have to pay our staff to work in the emergency department even if we don't have a single patient in there. Where a surgery center, on the other hand, they can specialize. So there's some surgery centers that say, we are only going to do eyes, and that's what we're going to do Monday through Friday, and then they have those set hours. So we're going to pay our staff from 7 a.m. to 3 p.m. Monday through Friday. After those hours, they can shut everything down. So it is just a lower cost of business for those coming into a surgery center. And then opportunity within our market. So if we look at who Mary Greeley primarily serves, we have a 14-county area, so this is not completely representative of every one that we serve, but 85% of our patients come from those counties there highlighted in blue. We do, you can see there, over 100,000 outpatient visits each and every year. That does include lab and radiology services as well. And then if we look at McFarland Clinic, once again, those are the counties that they primarily serve. They have over 1 million patient visits each and every year. And then if you look at this map of where surgery centers are located at within the state of Iowa. So there's a whole bunch south of us, and then there's one lowly one in Mason City, and then you would have to go either to Iowa City or out to the coast of the state to get surgery center access. And so we do absolutely have this desert in our service area. And so for you as a patient, if you wanted to have a lower cost procedure, high quality care with your McFarland physician or within our area, you would have to go somewhere else. And so we want to keep all of you. We want to keep our patients coming to our facility. So that was one of the big reasons we were opening this as well. And another thing in the industry, just more of an FYI, is we're starting to see payers force patients to make these decisions. So, for example, tonsillectomies with a certain payer here in the state. If there's a surgery center that offers a tonsillectomy for that pediatric patient within like 60 to 70 miles of us, so think of all those Polk County surgery centers, that parent can't bring her child to Mary Greeley or McFarland and get coverage. They would have to go down to the Polk County area to have that procedure. And so we have states all around us that insurers are already forcing that. So it's just a matter of time before we see that for all patients here too. All right. And then the timeline here. Like I said, we did have a 2-month pause in our timeline. We started these conversations in earnest back in, I'm going to say 2019. So a group of us from Mary Greeley and a group of McFarland Clinic providers got together and started doing some of the data crunching. Does it make sense? Is this going to be a profitable unit? Who would be included in it? And then COVID happened, and we literally paused everything for about 1.5 years. But then we got back together, started up again, and really started the work in August of 2022. Because our state has quite a bit of rules and regulations to encourage smart growth. I don't know how better to say it, but we did have to go to the state and show the need within our community. So that was honestly about an 8-month period of this project. So we had to develop a full project outline, why we need it here in Story County. And then we go to the state, we present our case, and then area hospitals and clinics would get the opportunity to say, actually, that would really harm me, X, Y, and Z hospital that's close by. Luckily, no one really did. We didn't have any opposition, and so it passed pretty easily through the state. So then once that happened, then we could really start putting holes in the ground and in earnest make this a reality. So right now where we're at, we're still in this construction phase. Everything on this timeline, unfortunately, pushes out by about 2 months. So we get our substantial completion end of September-ish. And then with surgery centers, we get to do 10 cases, I'm going to say for free, because we don't have any payer set up. We don't have any accreditation yet with CMS or Medicare. And so we do these first 10 procedures. They're usually GI cases, super safe, everything's ready. We do the 10 cases, and then we pause everything. And then we invite our accreditation bodies, CMS, to come in and just review our policies, procedures, make sure that the building itself, everything is safe and sound. Once we get that accreditation, it takes about 2 months, then we can start working with our payers to allow cases to be done at the surgery center. So even though we're going to open, do those first 10 cases sometime in September, we probably won't see most of the cases out there until about February of this year. And then it'll be a slow add to the facility. So we're going to start maybe with the first maybe GI cases and a few other specialties, and then we'll continue to add as we understand this building a little bit more. So it really looks like January of this year or February, we'll see most of the cases out there. All right, like I said, very high level. What questions do you have? What have you heard? I would love to go into more detail about anything we discussed.
And just go ahead and raise your hand. I've got one right here.
So what are you going to do with the outpatient surgery at Mary Greeley?
That's a great question. So yeah, this obviously has an impact on who we are at Mary Greeley. Right now, we have 10 OR starts every single morning, and then we run about 6 GI rooms every day. And so once this surgery center opens, we estimate anywhere from 50 to 60% of the cases we currently do in the hospital will be done at the surgery center. So it's about half of what we currently do. GI cases should be done in the surgery center. That's the best place. So that department will just be smaller. And then as we look at surgeries, this is our ability to add more inpatient-only cases. So our recruitment of surgeons is key. We have room, we have the capability to do more. So our recruitment efforts are in high gear right now. If you think of some of the orthopedic cases, certainly some of the spine cases that we do, there's a big community need. And now we're able to bring more of these patients in because we have the room to serve them. I would say our capacity has absolutely been met at Mary Greeley. And we would have had to do something regardless because we just don't have any more space for additional service lines or providers. So we're going to decrease for a little bit, and I very much see us ramping up quickly with other physicians and service lines here. The next question may be related to staffing with all that. And so with that, there's also a reduction of staff that's going to be needed here at the hospital. However, our community needs the same number of staff. So some of our staff are choosing to work at the surgery center. Some are choosing to work here. So we're right in that messy middle right now of trying to figure out who's going to go out there, who's going to stay here, and what is that staffing level that's going to be needed come February of this year.
And if you said it, my apologies. Did you say how many different ORs and how many are GI? And I mean, are there different specialty rooms out there or?
Absolutely. So out there, there's going to be 6 OR rooms at this surgery center. It's a big center. Most surgery centers have anywhere from 2 to 4. So we have the ability to care for quite a few patients and obviously all those different specialties out there. We plan to start, like in February, we'll probably have just 2 OR rooms running. But once we're at full capacity with our current physicians and patients, we're going to run about 5 OR rooms out there. So then we have that 1 extra for growth. So our intention very much is to grow the services here at the hospital, but then also we have capacity out there to continue to grow. For our GI cases, there's going to be 4 rooms out there. So we would expect the ability for 2 GI docs to be out there at any given time running through those cases.
I've got an online question. What percentage of surgeons have signed on for the surgery center?
Great question. So those that are eligible, I think all are eligible actually, but all of them. We had 2 physicians that are retiring before this was open, so they did not buy into the surgery center, but all other surgeons that were eligible have.
So besides the cost for the patient, it sounds like it will save patients money as well. What will be different for somebody going for a procedure out there than coming here?
So glad you asked that too. So one of the benefits of a surgery center, if you've experienced Mary Greeley, we provide excellent care. It's a beautiful facility, but you have to drive in. Usually you have to drive up the ramp at least 1, 2, 3, 5 floors. Then you ride the elevator down, you walk across our street, you walk into registration, you walk half a city block back to our short stay area. It can be overwhelming for our patients. And we see a lot of our patients coming from rural areas as well, where this is just overwhelming. Where some of the benefit from a surgery center is you pull right up to the door, you walk in, and it's very quick. The benefit of a surgery center is increased efficiency. So it's a very quick process. You get in, you get out, and it's really that same day procedure. So that's the real benefit. And the quality of care at surgery centers has been shown to be equally as high as like inpatient care. So there's no concern there with quality of care. And then along with that, I didn't speak to how cases are selected. So I already told this group 50 to 60% of our cases are eligible to be done out there. That means 40 to 50% stay here at the hospital. So the cases that will stay here are for patients that maybe have greater medical needs. There's something it's called an ASA score. So our anesthesiologists, they go in and they look at the condition of the patient and then the risk of the patient. How risky is it to put this patient under full anesthesia? So based on that risk score, and then some other things like pediatric patients under the age of 1, pediatric patients with tonsillectomies that are less than 3 years old, probably not the safest place initially to be doing care. And so those type of patients will remain here at the hospital. And then those that are smaller procedures, easier procedures, maybe procedures that you don't have to go fully under anesthesia, those would be more appropriate to be done out at a surgery center. And so that would be a conversation with you and your surgeon too, on if you're a candidate for that.
Here's a question over here.
Hi. Are there specific hours out there? And if so, wouldn't that be a recruitment advantage?
Yeah, so some staff are so excited about this because it's generally Monday through Friday, and then 7 a.m. I'll say to about 3 p.m. And then that obviously can flex based on that surgeon preference, but there's no call, there's no holidays, there's no weekends. So some staff are very excited to work out there.
Okay. And can doctors work at both the hospital and the surgery center, or some assigned only to the surgery center?
So yes, the physicians will still work at McFarland Clinic, and then they'll have cases both here at the hospital and out at the surgery center. And so that's some of the stuff they're working through right now too, is their schedule is going to be kind of moved around quite a bit. So trying to understand when they can be in clinic versus when they have to be in the hospital and out there.
Do you have an anticipation of what percentage of procedures that are done at the surgery center might have to be transferred into Mary Greeley?
Yeah, that's a really important. So part of the requirements to open a surgery center is, once again, only cases that are appropriate for a surgery center should go out there. And then we do have a transfer agreement with the hospital. So that means they call 911 if something bad happens. Our ambulance would come pick them up. They would come through our emergency room and then taken to the appropriate level of care. We work with a management company that's helping us open this facility. They run several surgery centers around the Midwest, and we ask that same thing. So how often can we expect a patient to be transferred from the surgery center back to the hospital? Their response, and once again, they have 10 plus surgery centers around us. They said they've seen it once in about 5 years. So it's very infrequent. That would not be the ultimate outcome.
Assuming that the insurance is approved, assuming that your insurance is on board, who will have the final decision-making process? Can a patient say, absolutely not, I want to be in the hospital versus the surgery center?
Yeah, so that's a really good question too. And Yes, patient choice is always a consideration. This would be a really important conversation for you to have with your surgeon, and maybe there's specific reasons why the hospital just makes the most sense. So that would be that coordinated conversation with your surgeon. And I think early on, we're all gonna, nervous isn't the right word because it's high quality. We have the same equipment, we have the same type of staffing out there. There's really nothing different, but it's gonna be new. So I could see everyone being a little bit more cautious early on. And then once we do procedures, even a few weeks out there, I think people will just start understanding like it's probably not much different.
For the employees, the benefit structure, I'm assuming at the ACS is going to be different than at the hospital?
It is. So it's the surgery center is a separate for-profit entity. It's an LLC. It's not part of Mary Greeley Medical Center. And Mary Greeley, as a city-owned hospital, we do have IPERS as our retirement benefit here. And so that is a big consideration for a lot of our staff. If they've been here, if they've met their 7-year of retention here at the hospital, a lot of them aren't wanting to give up that IPERS benefit. So the surgery center will have 401k instead, and the benefits are fairly similar. What we see in the industry is a surgery center RN, for example, makes about 5 to 8% less than an RN in a hospital would, and that's just because of all the things we talked about. It's daytime hours, Monday through Friday, no call, no weekends, and so that also weighs into some of the decision-making our staff are making. Good question.
All right. Any other? Oh, here we go.
Say during a somewhat simple surgery like cataracts, a patient has a complication like a heart attack.
Yeah.
The only choice you have then is to dial 911 and get an ambulance there. Is that correct?
Yes, but luckily we have the doctors right at the bedside. So all of the nurses that will be in these rooms are advanced care life support certified, meaning they understand what to do in a code situation. We'll have all the code carts there. And then the surgeons, the anesthesiologists who run the codes here in the hospital, they're literally at the bedside. So you're in a really good spot if you do unfortunately have a heart attack or something on the bed, because it's a good care team and the supplies will be there to help. But then, yes, we would call 911, so then we could get you either to the cath lab or where you need to be for that next.
Once the surgery is complete, the surgeon probably leaves, the nurses leave, and the patient's still waiting to recover. If something happens then, you don't really have the care there for emergencies.
It's pretty similar. So with these nurses having that advanced care life support, part of the benefit of these procedures out there is the recovery period is a lot shorter as well. So yes, there may be a period of time where those very last patients there wouldn't be a provider in the building, but I actually don't think it would be as often as we would expect it to be, just because it's so quick for that recovery. Yep.
And so I just want to know, because we may not all understand this. When you say provider, are you saying physician or surgeon? There would always be a nurse still there, right?
Oh, yes. Yep. And so there are some surgery centers in the U.S. You can do what's called 23-hour observation care. We've built the center to allow this in the future, because I actually do see the industry going this way. Payers, I think, are going to start, I don't want to say forcing us to do some of these things where you might stay overnight eventually at a surgery center. And then we would have the same care team like we would have here at the hospital. So we would always have a nurse at that bedside, even now. So we're not doing overnight care, we're doing same-day care. But there's always certified nurses in that advanced life support at the surgery center. And then the surgeon and anesthesiologist is what I meant by provider.
All right. Any other questions? Right back here.
I'm sorry, I just am not wrapping my head around this, how it can be cheaper. You're building a building, you're putting in all new equipment. I'm lost.
I know. So the initial capital expenditure is very expensive. So we don't expect to make any type of profit in our surgery center for at least 3 years. So because of the expense of building the surgery center. And so we expect to take somewhat of a loss that first 3 years. It's the after. Then we start making a little bit more money because of the efficiency. I always like using orthopedics as an example. So right now in the hospital, we'll take an orthopedic surgeon. They're generally on call. So they're going to come in to do their 7 a.m. case. Let's just pretend it's a right total knee. So the room is set up for a right total knee. Their next case might be a total shoulder. So then we got to take the patient out. Then we got to go in, change equipment around. We got to bring in new pans. We got to open up everything. And now we're ready for a shoulder. Now the surgeon's going to get called away to that ER case because something just came into our emergency department. He's caring for that. And then he's going to come back, do that shoulder case, and then maybe that ER case. So it's just the inefficiency of our OR services it's necessary. I mean, it's the way it works, and it works very well. But a surgery center truly, for orthopedics, for example, could choose to do Tuesdays are right knees only. So you have everything set up for just right knees. You have everything ready. You plow through 4 or 5 right knees, and then maybe your Friday is all left knees. And then you get the room set up and do only left knees. It's kind of crazy if you really think about it. And our ORs are open 24/7. We always are paying at least 2 call teams. We're always paying our surgeons for that on-call time. And we are in there whenever the patient needs, which is just increased cost to that whole services, that whole surgical line. But yeah, the first 3 years will be expensive.
So
Oh,
the other
and-
online question I have is, will joint replacements be done at the surgery center? And it sounds like they will be.
Yeah, so joint replacements are eligible to be done at a surgery center. And once again, it'll be based on the patient risk. And if you would have asked about 5 years ago, the answer would have been different. So 5 years ago, we didn't do joint replacements very often out at surgery center. It's a very common thing now. Spine is the next huge movement we're seeing. So spine cases up until about 2 years ago, they were just too expensive. So to your point, there's some really expensive equipment we have in our ORs, like the robots, some of the spine equipment. That does not make any sense to bring out to the surgery center right now. We would lose money the whole time because the reinvestment on buying a $1.5 million robot out there just doesn't make sense. And so we have to make sure that we're selecting the right type of cases, the right type of equipment, and the reimbursement just has to be there. So that's part of our other decisions on what cases go out there and what don't.
My friend and I drive each other to colonoscopies because obviously you can't drive after. If I choose to just drop her off and wait for her, is there a restaurant or a cafe out there? Because I like food.
Or a waiting room. Yeah.
No, it's so good. We talked about this quite a bit, and we actually went through, like, what would it cost to put a coffee shop out there? But to your point, like, coffee shops are just too expensive to run, so it would not benefit the surgery center to have a full-blown coffee shop. There will be some refreshments out there. Cabin Coffee, and I think Jimmy John's is just right around the corner there. So for people that are waiting a little bit longer, you have options.
And Pizza Ranch.
And
Pizza Ranch.
It's right behind Pizza Ranch. Thanks, Tim.
All right. Any other questions? And, you may have heard in my introduction, Amber is over a lot of areas here. So I think she'd be okay if you had some question here about the hospital or some of those areas we spoke about or anything else like this. We've got her here now,
And one thing I could add to the question of, do you do total joints out at the surgery center? 5 years ago, we really didn't. Now we are. I would question that, right? Why didn't we do it 5 years ago and now all of a sudden we are? Our equipment, the joints that we put in are just so much better. Each and every year, things just get better and better. So I always use the example when I was first a nurse here at Mary Greeley. So back in like 2004, when we had a patient come in for a total joint procedure, they would be admitted the day before. They would get admitted to our surgical unit. We would feed you, we would bathe you, we would shave you, and we'd make sure everything was ready. You'd get brought down to the OR the next day. Then you would come back up to that surgical unit, and you would be on a pathway for 3 days to make sure you are well enough to go home. That same patient can come in today. You would come into our short stay unit at 7 a.m., for example. You'd have your surgery, and then many of those patients are going home same day. So we have better pain control with some blocks, with new medications, and the the equipment, the joints that we're putting in are just so much better. The procedures are so much better. There's less cutting, there's more robotics involved. And so it does make more sense to be done out at an outpatient center now. And Linda knows all about that, right?
Could you tell me how many more physicians you're able to hire as a result of how many more will be coming in Ames?
Yeah, so we have some exciting recruitment going on, and I should have brought that list because it would be really exciting to tell you all about it. But coming in less than a month, we have a new total joint orthopedic surgeon coming, Dr. Kohler. So you may recognize his name, went to Ames High, he was a big athlete around here, so he's coming back to our community. We also have recruited Dr. Leyland, also, I think a Ballard kid, very recognizable name. He'll be here. He's just doing some fellowship work right now, but I believe it's 2 years he'll be here. That's a big sport medicine doctor that's coming. We've just been able to hire a new eye ophthalmologist coming. She's here. Urology was a huge recruit. So urology just nationwide, there is a desert of urologists. There is such a need for urology. We've had recruitment for this one specialty for as long as I can remember. I've been in this position for 8 years, and we had open recruitment for urology for 8 years. And we have Dr. Paul, he's here. We've been able to recruit for that position. So it is enticing for these surgeons coming here. It's just a great benefit for our community.
Okay, so those are doctors that you've been able to recruit because we have the surgery center, is that, or, 'cause I'm wondering, what about here at the hospital? Are there some new specialties we're looking at bringing in now because we will have the space? And what are those?
So I don't know if we can say they came just because of the surgery center, but it did not hurt.
It did not hurt.
No, and we saw a drastic change. It wasn't so much of, you have a really nice community, but so it has. We've seen a nice increase in the recruits into our community. And then for the hospital, what we're going through right now is, it's part of our strategic plan, and many of you will reach out to our community again because we're going to have the next strategic plan cycle starting this fall. But we identified some key service lines that we know there's an opportunity here in our service area to grow. Cardiology services is one. So right now we have a cath lab. I would say it's underutilized. And so how can we partner with Iowa Heart and McFarland Clinic, Mary Greeley Cardiology to grow this service line for our community? If you would come in with a heart attack, right now we don't have 24/7 coverage for cardiology. So that means if you came on a day that we didn't have a cardiologist on, you would be transferred probably to Des Moines. So we're looking to help recruit that, bring that back into our facility. We now have room down on that first floor. So potentially, like, could we grow cath lab services? What does it look like to grow those cardiology services? Another service line is spine. So Dr. Geisinger came to our community a couple years ago. He's fantastic. Really, really skilled surgeon, and there's a great need within our state, honestly. And so he's excited about growing the spine program. Most of these procedures stay in the hospital, so this is where we're working with him. What does it look like? When do we bring another surgeon in? How do we do some of that outreach? Orthopedics is another one. We've had some really good recruitments in for that one, especially as it relates to total joints. So maybe you've had a call into orthopedics. Sometimes that wait time is really long, and when you're in pain, that's probably not okay for you. So we are seeing a lot of patients choose to go south to get some of that orthopedic care. So getting more surgeons in for orthopedics is tremendous. Cancer services is another big service line that we're looking at. So we lost one of our general surgeons a few years ago, and one of his specialties was breast care for some of our breast cancer patients. And so, like, looking, what does that look like now? Is there an opportunity to grow some of these services within our cancer line? And then women's health is the last one. Like, how can we make sure that women's health needs all the way from giving birth through death are met here within our community? So we are looking to grow all of those services. And so when I say, like, we're going to go down a few ORs, I don't think it'll be super long. I can't bring in another surgeon right now because we just don't have another OR room to put him in. But once we have some of these cases shift out, we have a lot more options.
Okay, got another online question. If a surgeon does a procedure at the hospital and gets so much money, would he or she only get a little less money at the surgery center for the same thing?
Yeah, this is healthcare billing is crazy complex. Our CFO would say that, like, he came from a non-healthcare industry and eyes wide open. Sometimes our reimbursement strategies don't really make sense. But the way this works, very high level, is the professional billing fees. So what the surgeons make, as I understand it, are the same, regardless if you do the case here at the hospital or out at the surgery center. It's the technical fee, the facility fee, so it's all the other stuff. It's the nursing care, it's the bed, it's the medication. All of that technical fee is less if you do it out at the surgery center.
What are you doing about dermatology, and will Mohs surgery move to the ACS?
Good question. Right now, dermatology is not a service line that will be done out at the surgery center. And then I don't know any more information. Since it's not a hospital service, that would certainly be a great question for McFarland Clinic. I just don't have much more information. I certainly know what they need.
Am I correct that Mohs surgery, they do that in the clinic?
Yep.
Yeah.
Yep.
Okay. Any other questions? All right. Well, Amber, great presentation. Lots of wonderful information and very exciting for our community. I think everybody has the right to kind of be like, okay, I'm not sure what this is going to be like. Will this be right for me? But I bet, like you said, once we get it open and they see how it's working, and and we have obviously very high tech here, but this is a brand new building. I bet it's pretty amazing, even the differences between what's here and what's out there.
It is. It's going to be brand new. However, part of the cost savings and why we can do this a little bit cheaper is we have all the equipment, all the trays, the implants to do all of the cases here at Mary Greeley. So once we transition 50 to 60% of those cases, we no longer need all that stuff. So we can sell some of that stuff to the surgery center, and we are trying to be efficient in the equipment we use. So God forbid we have like something drop on the floor out at the surgery center, we can quickly, run it out to the surgery center. We can be good partners with some of the equipment that we use too.
Oh, yep. One more question here.
How much of the surgery is involved with the robots?
Oh, yeah. Quite a bit. It depends on the specialty. So urology, general surgery, gynecology, big users of the robots here. We actually have 2 robots within our ORs, and their utilization's pretty high. It's very exciting.
And just so everybody stands, will you explain that it's not the robot doing the surgery, that it's actually a physician doing the surgery?
It's actually the surgeon in the room. We should do another one of those. They're just fascinating to watch, and they're looking into, the microscope, the screen, and they're doing all of this with their own hands, with their own skills. And robotic care within the OR, and I think we could say this for a lot of healthcare, has just revolutionized things. Dr. Taylor, one of our general surgeons, would be the first to champion it. With some of the cases he did, he would say, with this certain case, when I had to cut that patient open, maybe take out part of a lung, and sew that person back up, that patient was in so much pain, there was so much additional eyes on that we would need, that patient would be here for a week or 2. He can do that exact same case with the robot, minimal pain. Sometimes our patients say there's no pain at all, and the patient can go home usually within 3 days. So just the precision and less cutting, less manipulating that these robots are able to do really have changed the way that we do surgery.
And it's been years, but we've done one, and I do remember being so amazed. Like he talked about, here's my hands, my 2 hands, trying to get those down in and do this little arm that can get in there and turn 360 degrees and get into spaces much smaller than what your hands. So it's less invasive and probably the more precision.
Absolutely.
Yeah.
And those cases would stay here, so you're not going to get more pain and less care at the surgery center. I mean, the cases that don't need robots will be done out there. The cases that benefit from robots will stay here.
Another online question.
Okay, go ahead, Tim.
We've had a surgical center experience in another community where it was clear that the doors closed at 5. but we weren't feeling comfortably ready to be discharged, especially with the drive back to Ames. Is this something that patient and doctor can discuss before choosing where to do the procedure?
For sure. Yes. So if you have limitations on maybe being able to drive at night, or if you have things in the morning, that should all be brought to the attention of the surgeon, because that would not be a good candidate to be that last patient in the surgery center. Because yes, we want to get patients out the door so we can, it's just part of how the business runs. But if you're going to need a little bit more recovery time, if you have a longer drive, please let your surgeon know that, and then we can schedule appropriately.
Will there be an ASC open house for the community?
Yes, I'm so glad you asked that. There will be an open house. I just don't know when quite yet. It would certainly be this fall. We'll make sure that Vicki has all the information so you can come see it yourself. And I'm sure we'll have some video of it as well. So if you're not able to attend, we'll have that posted online so you can get kind of that virtual tour as well.
All right, last chance here, everyone. All right. Well, once again, thank you, Amber. Great presentation, lots of wonderful information, and very exciting for our community. Thank you for joining us online as well. Those of you here in person, please fill out your evaluations, and I'd love your ideas on other topics or presenters you'd like to hear from. And just as a reminder, our next program, gosh, we have a little break here because we have a trip coming up and some other things like that, but will be Tuesday, September 17th, 2 o'clock here in Bessie Myers Auditorium, and it's on Vitamins 101. If you came to our program earlier in the year on over-the-counter medications, Ellen Heikens, one of our pharmacists, did that program, and we had lots of questions about vitamins. So she said she'd love to come back. She does a great job. So that program, again, is Tuesday, September 17th. Thank you for coming out. You can drop your evaluations off in the basket on the table in the back. Thank you for joining us.